welcome back to the second hour of LoveBabz, Love Talk. I'm Babz Rawls-Ivy, that's Harry Droz. So we're waiting for James Michel to come on, the CEO of Access Health, Connecticut, and he's going to talk about open enrollment, which is happening now, and some of the ways in which they are helping to close the health equity gap. So open enrollment started November 1st. They got lots of ways that you can reach out to them. They've got a great website, which is a very user-friendly website, I must say, Harry. Like, you never have to talk to anybody. But for those people who really need to talk to somebody, they got sites so you can actually walk into some place, have somebody sit down and walk you through the processes, help you choose whatever the healthcare suits you. Or you can just call somebody up on the phone. And they're really good about that too. One of the few places, Harry, that still have people answering phones.
Yeah. Yeah, that's a good thing.
Yeah. Yes, Harry. Saturday Night Live did a skit on on when he was trying to cancel his cable subscription. Harry, everybody in that audience and everybody who was watching understood that pain.
For real. I mean, I go through it. I go through it a lot. I'm screaming at my phone, agent! Agent! Sometimes I lose it.
And every time somebody new come on the phone, it was like, so you want a landline? He's like, no, I don't want a landline. And then he looks up and the tech guy is in his house talking about, okay, so where do I set up the landline? It was really good. It was hilarious.
And then every person they transfer you to wants your account number.
Oh my God, Harry, as if they don't have it. I'm like, y'all have it. Like, when the bill is due, you know how to tell me what it is. Like, oh my God. Oh my God. So yeah. So I'm just waiting for him to come on and talk about open enrollment and what this looks like. Because they're rolling out this big thing. So
it's open enrollment for a month or a month and a half or something like that.
I don't know. Let me see. I think it says it might be for a month, Harry, but yeah.
I know on the commercials.
Well, no, from November 1st through January 15, 2022.
So it's Medicare that's open enrollment.
Yeah.
For a month, I think.
Yeah. I don't have Medicaid. Like, I'm not in that age group yet. Give me a few more years. I'll be sitting on that line too. Like, hey, the old lady needs her health insurance.
Yeah, I'm the guy you can sell anything to. Right. What I mean is, if it sounds good, like the other day I was convinced I was blind, right? Because all of the symptoms. And I'm like,
okay, Harry, were you not seeing? Because that's the only way.
I know that's the thing, right? So, but I'm listening to the symptoms, and I'm like, man, I got all of that. I wonder what this is, and then I notice it's a blind guy they're talking about, and I'm like, okay, that's not me, but I got all the symptoms.
Oh my God, that is too funny. Okay, Harry, you are silly.
It actually took me like 3 commercials to figure out that they were talking about a blind person. Or it was like the 3rd commercial that I said, wait a minute, that's for blind people. But
yes. Well,
good.
Listen, I heard some symptoms the other day, Harry, and I was like, I'm going to see my doctor tomorrow. Because I was like, I don't want to be one of these internet doctor people. Like, I don't want to be. I was like, let me just go to the doctor and tell him, this is what I'm experiencing. Rather than trying to diagnose myself and getting it wrong. I was like, I'm working myself for no reason. You know what? How about if I just do the smart thing? And so I have an appointment tomorrow. So I'm going to see my doctor tomorrow. I'm like, hey, it's happening. I don't think it should be happening.
I always forget what to say when I walk into the doctor's office because I'm not experiencing whatever pains and stuff like that that I'm when I'm sitting in the doctor's office. So I'm like, they go, well, so how have you been? I'm like, pretty good. Oh, I'm doing good right now. So I totally forget everything. I come home and I sit down and Karen goes, so that you tell your doctor this? I'm like, oh, no, I forgot. I forgot.
Harry, is anybody in our hostage room? Did we check?
No,
There's
that's
nobody
nobody.
there. Okay, well, I don't know where Mr. They went to great lengths to schedule this time. I just sent the login stuff again. Oh, he might be running across the parking lot. So we'll see. Like, yeah, we confirmed and everything. So he's
Well,
logging on.
you know how it is when you start dusting off your computer on Mondays. Your computer goes, Zoom. What's that? Like I use you every day.
Harry, ain't that the truth? Because when I sit in this chair on Mondays and I'm thinking, and my computer acts like sometimes I can't even get the login screen to come up. I was like, what the hell is wrong with this thing? And mine is a touch screen, so I could touch the screen, I can use the mouse. And it's like, I'm gonna do it when I'm ready to do it. See, that's why artificial intelligence, I'm not with it. I'm resistant to artificial intelligence. I'm just, it's too much like Skynet. It's too much the makings of Skynet for me. I'm just saying. I don't think it's gonna bode us well. All this technology. I think these machines are gonna rise up and be like, humans are a problem. Humans are the problem. So I'm just saying. So hopefully he'll get on here and get it on. Although Harry, I wish I, these airline flights to Florida from Tweed, $55, Harry, $88 round trip. I would just go to Orlando just for the hell of it. Or I'd go to wherever, Miami. I'd go to Miami, Harry, just for a couple of hours. I mean, for $100, Harry, I could go in the morning and I could go in the morning, have lunch, a couple of drinks, and catch a late flight home.
And how do you confirm that they're actually gonna have that flight? So many flights are being canceled these days.
Well, no, this is one out of Tweed, the new Avilo. Oh, there's Mr. Michel. But the new Avilo, Harry, like my friend Dallas flew down for a weekend, $88 round trip. Now these fares are gonna go away, but
yeah. Well, I mean, I'm not chancing it. I'm gonna give it another 2 years.
Harry, you better go now when these fares are good. Hey, Mr. Michel.
Good morning. How you doing?
I'm good. How are you?
Okay, good to see you.
Good to see you. You're a air flight commander. How are you? Open enrollment. Well.
Yes, I'm doing well. And you?
We all got our challenges.
Mm-hmm.
Just rise when we can.
You know what? I remember growing up, the good Lord won't give you any more than you can handle.
Okay. I've had enough then.
I know, I hear you. I really believe we go through things for a reason, preparing you for the next challenge in your life.
It better be preparing me for a couple of $100 million. How about that?
All right, that's coming your way.
All right, so y'all have this. Well, it's annual open enrollment.
Correct.
Started November 1st.
Yes, started last Monday.
Yes,
was the very first day of open enrollment. This is our ninth open enrollment. And open enrollment this year will go through January 15th.
Okay. Is this longer than it normally
It
is?
is. Normally we start out with December 15th. We end with December 15th. But however, if you want to have coverage starting January 1st, you have to have your plan selected by December 15th.
Okay.
Then after that, then your start date will be February 1st.
Okay. Okay.
Okay.
And so are you surprised at the number of people in Connecticut that still don't have health insurance?
Well, Connecticut, as you may know, is the best in the country with respect to the uninsured. Because right now, the national uninsured rate is about almost 10%. We are about 5.4% of uninsured. Right. So we are among the best in the country. And there's roughly about 200,000 Connecticut residents without health insurance.
And so what do you make of that? And how do you capture those folks?
Right. So there are some folks, you will never be at zero. You will always have people who do not want health insurance for religious reasons, for a lot of different reasons.
Really?
There might be 1 or 2% folks who, whatever, they just don't believe in any mandates. Then and we also have of that 200, about 40 to 50,000 of them are undocumented.
Okay.
Connecticut residents. Right.
And undocumented people can get access to health insurance, can they?
No, they cannot. They cannot get any. They don't have health insurance. However, if they get sick, they go to the hospital, they will be served.
Okay.
Right. The hospitals and the federal qualified health programs will support them. Right? Every major communities have what they call FQHCs. And so they will. Their community health centers. You go there. They don't ask for any evidence of who you are.
They won't turn people away if they.
No, they won't. They will take care of you. They will take care of you. Okay. But however, unfortunately, because of that, preventative measures, getting annual checkups, getting blood work done, and just getting regular checkup. If you're a woman, you want to get Pap smear. You want to have all type of preventative checks on a regular basis. If you don't have health insurance, it's hard for you to do that because they're very expensive. But if you have health insurance to access health, they are free. No copay, no deductible for the preventative stuff.
Okay.
Right? It's all included as part of your plan. But if you don't have health insurance, it may cost you $200 just to get a regular checkup with the doctor.
Then, I know.
They got to do the blood work, X-rays, the AC1 checking for diabetes. Each one of them costs anywhere between $100 to $300. So just a regular checkup could become anywhere between $300 to $1,000. All of that could be avoided if you have health insurance.
Okay. So talk to me a little bit about, because you also are trying to close the health equity gap.
Correct.
And talk to me about that. Like, what does that mean?
Sure. So what we did last year, earlier this year, we completed a study, health disparities in Connecticut. And the study is on our website. The study indicated that Connecticut is among the healthiest state in the country. It's one of the healthiest states in the country. But when you look deeper into those numbers, the disparity between people of color and white Connecticut residents is among the worst in the country.
Whoa.
Right? Among the worst in the country. We're like in the bottom 10. I think we're number 7, something. But in terms of overall health and overall wealth, overall health, we're in the top 10. Overall wealth for the entire state, we are top 5. So which kind of highlight how crazy it is to have such a wealthy, healthy state, to have such a disparity between its people of color and its white residents.
So James, did you know that coming in? Because you've been here for a minute now,
right?
And this is I don't know if y'all have talked about health equity, but did you know this when you were starting to build this Access Health network?
Well, when we started, we knew. Yes, we knew it was a challenge for us. We didn't know how extent it was. But we knew it was a challenge because it was built into our mission
Okay.
back in 2012. So there were strong indicators that this was a huge issue in Connecticut. So back in 2012, when Access Health was first created, the people who created us included that in our mission.
Okay.
Right? And mission and vision. Right? So, but up until last year, our focus was getting people access to health insurance. This part of our mission and vision, we weren't ignoring it. It's just that we were trying to get the people access to health insurance.
Okay.
Right? And that should help address some of the disparities. So now the study we started the study last June of 2020. It was completed in February of this year. You know what? How bad is it, and what's driving it?
Okay.
So we have the data.
So what does it tell us?
Well, it tells us that the number one, the results are this. For example, we took data, people from West Hartford, and people from the North End of Hartford, two different demographics. West Hartford is mostly about 89% white, and in North End of Hartford is about 80 to about 90% people of color, less than 5 miles apart. The life expectancy between the two are 20 years different. So if you are a Black male, and what we did to dramatize this, we created two fictitious characters: Tyler, who lives in West Hartford.
Oh yes, I've seen this. Yes.
And Marcus, who lives in the North End of Hartford. We took the data, applied to each one of them. They were born all the way through them passing. Tyler lived to be about 86.9, and Marcus died at a 68.9, a 68.6 something. Right.
Wow.
But so not only is his life shorter, but the quality of life he lived for those 68 years were far more challenging and difficult than it was for Tyler.
Okay.
Now the drivers for that is lack of access to fresh food, lack of access to medical care, education. Because Marcus, we live in an economically depressed area, his school did not have the resources to reinforce or to support his education. He couldn't go to college, so he got a job making $37,000 a year. Whereas Tyler went on to college, got a master's degree, and his average income was about $110,000 a year. And so all of that drives into health disparities. And also, just having access to information was a challenge for Marcus. So all of that, it's not just one magic. There's a lot going on that's driving health disparities in Connecticut. And so as a result of that, Marcus dies at 68, and Tyler goes on to live for another 20 years. One of the interesting economic impact of that. Now, Babz, imagine if Marcus had lived another 20 years. Now, if he had retired, was getting a Social Security and a pension, we estimated that's about $400,000 at a minimum that community missed out on. And if he had lived for another 20 years, like Tyler did, he would be collecting Social Security and pension, getting that money, paying his rent, buying food, living in a community. That community is missing out on that $400,000.
Oh.
Right.
So what do you do with this information, James? Like, what do you?
So we've done a couple of things. We've done actually more than a couple. Number one is we've been spreading the word out nationally with the federal government and state and local community leaders. But we've also taken some steps within our organization. For example, we created a new position, a senior leadership position reporting to me directly, called Health Equity and Outreach. Just had a young lady, her name is Tammy Hendricks. She's our director of Health Equity and Outreach. Her job is to come up with ideas and thoughts and operationalize them to help address health disparities.
Okay.
right? Mainly going into the communities and doing programs, supporting programs, educating. So we have a lot of creative stuff that we're doing now. Most of it involved around communication, getting people access. Another program that we are doing that she's in charge of is we have this broker academy. The studies showed us that to buy health insurance, you probably need somebody to explain it to you. It's so complicated, right? And there aren't too many Black and brown health insurance brokers in the urban communities where the uninsured is highest, where health disparities is greatest. So, and that's mainly because to become a broker, you have to go through training, you gotta get a license from the state of Connecticut. It's pretty daunting when you start seeing what you gotta do to accomplish become a broker. So what we have decided to do, we are creating this broker academy where we will recruit. We'll start out the Bridgeport, Haven, and Hartford. We're going to those communities, recruit people who live in those communities, and put them through the training, and get them take the exam, pass the exam, certify them with Access Health, and help them get started. And we're going to pay for the entire process. Yes. All right. So
Wow.
by having people like you and me who live in the community become a resource, sell, educate, distribute health insurance products, you and I are more likely to buy it from somebody who goes to your church, or somebody if, you see at the barbershop, or somebody in the supermarket every week. There's a connection there. And right now, there's almost no person of color who live in this community. That could be a resource for people to go to to ask questions, also to buy health insurance from. And by the way, the help they give you is free. Right?
Wow.
You don't have to pay them for it because the commission they make money because there's a commission they get from the insurance company.
Mm-hmm.
It's built into the premiums already. Right. So that we think that's a very strong step in the direction of by having people, those communities, live there, you become a resource for communities. We think that will be very helpful in terms of helping to address the uninsured rate as well as health disparities. But if you have health insurance, we've seen the data. People without health insurance live 20 years shorter than those with health insurance.
Wow.
So you
Really?
see, oh yes. Because if you have health insurance, you have all the preventative
Well, yeah.
that's in
Yes.
there. If you don't have it, you go to the doctor when you're sick. Sometimes that could be too late.
Yes. And we've seen a lot of people using emergency room as primary care places.
Yep. And again, if you have to go to the emergency room, you probably, pass primary care. You need acute care. You need, you're having an episode. Somebody's got to go in there to take care of you. But if you're seeing a doctor once or twice a year on a regular basis, chances are they could have caught something. Whatever is sending you to the emergency room, they could have caught it earlier on, treated, then you'll be fine. Diabetes, heart condition, hypertension. So
okay, so the Broker Academy makes sense, right? Mm-hmm. Is there any examples of this being done anywhere else in the country?
No, we are it. We are setting a trail. Yes.
So do you have a number of folks that you are hoping to get or hit? Is
so
there
what
a target
we want to
number?
we want to start. We want to have 25 new brokers in each community. 25 in Hartford, 25 in New Haven, 25 in Bridgeport. That's just to start out with. Now, our goal is to have them all in place by this time next year. So when we have open enrollment next year, they'll be there. Answer questions and to sell. Now, this is also economic development as well. This is lucrative because for every person you enroll, your insurance company will pay you a $15 commission each month.
How much commission?
$15 per month per member.
Okay.
So, for example, if you enroll 1,000 people, that is not a crazy number. doable if you work at it, you can make $15,000 a month. That's $180,000 a year. That's if you enroll 1,000. If you do more than that, you make more money. And most of the work is done between November and January.
Mm-hmm. So people could, yeah, okay.
For the rest of the year, you could do something else the rest of the year. Because that money be rolling in every month for you.
I kind of like that.
Yeah. Well, look, you have a lot of brokers that do all this work between Medicare and us. They're making so much money every month. You know, they take from January into March off. They go to Florida.
So this makes sense because if you get people from the community who are in the community, they know where the people are in community.
Absolutely.
And they could spend the time with people and walk them through and say, these are what your options are, and this is what,
Because, you know, health insurance is very personal, right?
It is.
And
it very much is.
Right. If you're going to buy health insurance, you got to be comfortable with the person. They're going to ask you some tough questions. You got to be comfortable with the person. But you got to trust the person.
Okay.
If somebody doesn't look like you, it might be very difficult for you to kind of give them the full story, what your needs are. You're just not comfortable. They don't know you. You don't know them. It becomes very mechanical as opposed to something very personal.
So when are you rolling that campaign out? Like, when are you rolling that recruitment process? Right now, that takes a good while.
Yeah, no, actually, we're much further along at this point. Right now, we by the springtime, the plan is to have classes, everything in place. The recruiting is going to start within the next 2 months.
Okay.
So we're going to travel into Bridgeport, New Haven, and Hartford. We're going to community leaders and talk to them and explain to them what we're doing, why we're doing it, and do they have any recommendations for?
Okay.
So right now we are laying out the entire process right now. What we're going to do, and it's somewhat like a big project plan. And once we are all set, then we're going to start executing it. And the first thing we got to do, we got to start recruiting.
Okay.
Then we got to hire a company to do the training. Right. So again, it's working out well, and we are ready to roll. And the plan is to get this going, start recruiting with in the new year, February, March.
Okay. So that's not far away. That's just on the other side of the new year.
Yep.
So do you think this will help with the health equity disparity?
Yeah, absolutely, because the more people that have health insurance, this will certainly help them to get healthy. You know, if you have health insurance, chances are you're going to see a doctor on a regular basis, and then if anything's wrong with you, they catch it and treat it before it becomes a big crisis. We think over the long haul, this is definitely would be one of the key steps to helping to address health disparities. Having brokers in the communities where health disparities and the uninsured rates are the highest. And also, there's also the economic development also. If you have 25, folks in the Bridgeport or New Haven, each making a nice chunk of change every month, that could be very helpful to the community at large. Well, so we're dealing with health disparities, the uninsured, as well as economic development.
Okay. Wow. Okay. So we are still in a public health crisis. We're still in the throes of the pandemic. We're not out of the woods. How does that press upon the health insurance industry? And how do you get people to sort of say this is important?
So you gotta talk to them. You have to go meet folks where they are. What we've been doing, you may be familiar with this, Babz. Last March of this year, rather, President Biden signed into law the American Rescue Plan Act. This was a plan that's going to help address the pandemic. It provided a lot of financial relief to a lot of folks. One of the things it did, it made health insurance far more affordable for everybody. It lowered health insurance premiums for most people this year and next year. So, for example, we have some examples. We have families that were paying about $1,800 a month for health insurance. Family of 4, Now they're down to about $300 a month.
Wow. That's a good savings.
That's $1,500. That's $18,000 a year. That's a mortgage for a lot of people.
Yes.
Right? So that's just an example of how the American Rescue Plan is helping to make health insurance more affordable for most people. And again, if you have health insurance, you're more likely to be healthy.
Mhm.
That's what the data is telling us, because of all the preventative medical tests that are fully covered, no cost, no out-of-pocket costs. There's some people who did not buy health insurance because it was too expensive. They've come in now to buy it because it's affordable now.
Okay.
Right? So that has helped. The other one also, one thing you may have heard or read about this. A lot of folks, because of COVID, they weren't seeing the doctor on a regular basis. They weren't doing the colonoscopies, pap smears, and other tests that they do on a regular basis. The insurance industry is expecting, when things clear up, there might be a spike in those disease because they didn't catch them early enough. So maybe a year or two of not doing those tests, some of those issues that could have been caught earlier might become worse than they need to be. That might spike up the cost of healthcare for some of the insurance companies.
Okay.
Right.
All right. Okay. So Connecticut has lowered the cost of insurance.
Health insurance, yes.
Health insurance for folks. There's all kinds of ways to access Health Connecticut, so people can get correct through information.
Sure. So there are two ways to do it. Number one is you can go to our website, accesshealthct.com. And let me repeat it one more time, accesshealthct.com. Or you can call our call center, 855-805-4325. 855-805-4325. And again, the call center is open Monday through Friday, 8 to 8.
You have a good call center, I must say.
Yeah, thank you. And on Saturdays from 8 to 3.
Because I've called it a couple of times. And I'm never on hold forever.
Right.
And they're very helpful and they're very polite. And I don't feel like I have to go through this whole thing. Right?
So
Somebody
far,
actually answers the phone.
Yes. Which is unfortunate. The bar is so low. Just answering the phone is success.
No, somebody actually answers the phone. I never feel like I'm waiting forever, and all that other kind of stuff. I feel like, oh, this customer service, like what? I'm always startled when somebody answers. I'm like, oh, I wasn't expecting you to talk to me. Okay. So what are some of the things that people can access through the Access Health? Like y'all have relationships with other departments around services.
So when you go to Access Health, you will get access to our application if you want to apply for health insurance. And we have two health insurance companies in the exchange. We have Anthem, Blue Cross and Blue Shield, and we have Connecticut. Connecticut.
Yes.
Yep. We have Connecticut, and this is our website we're on right now. In Connecticut, and this is the other insurance company in the exchange. And obviously, everything we do is in both Spanish and English, right? And so you can find a plan. And we also have small business. You see on the website, learn about our commitment to health equity.
Yes.
Yeah, so I was just talking about the health equity. We have a whole new website dedicated to health equity. There's a lot of information on there. So to your question about, we have a lot of partnership that we've set up with other organizations to help us address health equity.
Okay.
A lot of community-based organizations help us with health equity. So again, we look forward to participating with the communities. And if you know of anyone at all who's interested in doing anything at all with respect to the health insurance brokers, please let me know. We are ready to engage with them, get them going.
So James, so who are the brokers now? Like, how do people find brokers now? Like, how does that work?
Yeah, so you could go on our website.
Okay.
Or you can call a call center if you need help with a broker.
Okay.
Right? If you call our call center, we'll go through the process, and then when it comes time to pick a plan, they will assign a broker to you to help you pick the best plan for you. Because in Connecticut, you have to be a licensed broker, licensed by
Okay.
the state of Connecticut to give people advice on the best
Okay.
insurance plan for yourself. That's by law.
Okay.
Right.
Well, that's good. I mean, that's a
Mm-hmm.
good thing, right? So you don't have
Absolutely.
shenanigans and
Absolutely. Yeah,
feel like
exactly. So you have
taken
people who are not
advantage of.
people who are knowledgeable about what they're saying
Yeah. Okay.
to give you guidance.
Okay. Okay. So there's that. All right. So the open enrollment is now November 1st through January
15th.
15th, which is
Mhm.
longer than it's ever been.
Correct.
And you did that deliberately because
Well, because of COVID,
okay.
we think a lot of people need to have access, a little bit more time to make that decision. A lot of people, we think, again, this is one of the ways we're going to help address health disparities by giving people more time
Okay.
to come and make the plan, especially during these challenging times. One of the things we have folks, we have customers who've always done enroll with us in person.
Okay.
We have events in person. And we used to have them all the time. They're well attended, but because of COVID, we can't do
You
that
can't
anymore.
gather people, right?
Well, we
Yeah.
can, but on a very limited basis by appointment, and we have the whole social distancing requirements. We meet all of them. Because of that, it takes a little bit longer. That's how we've extended to January 15th. And remember, if you pick a plan after December 15th, your plan would not kick in until February 1st. So if you want January 1st coverage to start on January 1st, you should pick a plan by no later than December 15th.
So if you already have existing insurance, through the exchange or whatever, do you have to go back in and recommit to it, or
no? Most people don't. Most people do not have to, because we will automatically renew them in a plan that's very close to the plan they have now.
Okay.
Right. And but we have about 10% of our customers who did not authorize us to do that.
Oh.
Right. There's no box you got to check when you do the application. So what we do, we're going to send them letters and notes. We're going to do a lot of notification to them for them to come in and pick plans. And they've been doing that.
Okay.
They've been doing that. Now, but we tell all of our customers, listen, Babz, let's say you were one of our customers, you had an Anthem plan this year. And we match you up with a new plan for next year, very close to what you have now. We send you a letter telling you all this good stuff, and how much it's going to cost you, what your subsidy is going to be, what your net premium is going to be. We send you a letter, but we also encourage you, go to our website or call our call center and shop. So things may have changed for you. Yeah. Maybe you got married. Maybe you adopt a child. Maybe you have a kid now. So things may have changed for you that we don't know about. So we encourage you, go online, update your information, and shop and compare. There may be other plans, new plans that might be a better fit for you. And also, if you have any questions at all, we'll give you brokers for you to reach out to, and they will walk you through the entire process and ask you questions. Right. Maybe last year you wanted to. Maybe last year, because of COVID, you didn't want to have an operation. Maybe this year you do. Maybe in 2022 you do. Okay. So because of that, there might be a plan out there that might be cheaper for you to use if you plan on having some type of medical procedure done. That's how we tell all of our customers. Even though we are automatically re-enrolling you in a new plan for next year, you don't have to do anything at all. I encourage you, go online, call a call center, shop and compare. You don't have to change plans, but there might be a plan that's better for you, that's a better fit for you next year.
Well, thank you so much, Mr. Michel. It is good to see you.
Likewise.
And every time you come on and share information, I always get these messages from people like, oh, I had no idea. Oh, I feel comfortable getting insurance now, or I feel better. So you do a great community service for me, coming on and letting people sort of see you and hear you. Because I'm telling you, every time you come on, somebody stops me somewhere and says, I had no idea.
Well, listen, when I'm ready, when we are ready with the Broker Academy.
Yes.
All right. So I will re-engage with you, and I will bring Tammy Hendricks with me as well. Or maybe she could talk to you directly, talk about what we're doing, how we're going to do it, and when we're going to do it, give you all the details.
Oh, that would be great.
Okay.
That would really be great because I know people are gonna be
Excellent.
buzzing in my ear about that. So
Excellent. Because
well,
again,
thank you.
you're welcome. Thank you very much. Always appreciate talking with you.
Oh, it's always good
All
to
right.
see you. And enjoy
Likewise.
your holidays.
Thank you. You too. Thank
All
you.
right, Mr. Michel. Take
Thank you.
care.
Bye-bye.
Thank you. All right, Harry, we got it done today. I learned a few things about health and health disparities in Connecticut. So it's time for re-enrollment, people. AccessHealthCT.com, AccessHealthCT.org, AccessHealthCT.com. So it's November 1st through January 15th. So if you don't have health insurance, now would be a good time. Or if you want to change your plan, now would be a good time. That time. All right, Harry Jones, we made it through a Monday. Woohoo! Back tomorrow.